On the 11th March 2020, the WHO declared the outbreak of a deadly coronavirus in the world and named it as COVID-19 pandemic. And since then, everything changed. Lockdowns were imposed globally, economies went down, travel was shut down, all of us were stuck with whatever we were left with. Sanitizers and masks became a part of our lives. It was for the first time when the whole world was so badly affected with a disease killing millions of people in a very short time. It is May 2021 and India is still battling the devastating second wave of COVID-19. The number of COVID cases in India are hitting a record high with over 4 lakh new infections being reported daily. At this time of crisis, Brahmakumaris and Global Hospital Research Center Trust are doing a marvelous job by dedicating their infrastructure, manpower and resources in treating corona-affected patients in Mount Abu and Abu Road, Rajasthan. Over the past 85 years of its presence, the Brahmakumaris have played a significant role in almost all spheres of human social life. Presently, it is the largest spiritual organization in the world led by women. It has not only worked for the children, youth, women and senior citizens, but has also made positive contributions on the issues of environment, energy, value education and of course health. Brahmakumaris and GHRC hospitals have dedicated 4 of their holdings in Mount Abu and Abu Road, which are now serving as COVID care centers.
Brahmakumaris institution has established 3 hospitals. One is called Global Hospital and Research Center at Mount Abu, at our headquarters, and another is called Trauma Center at our headquarters, Mount Abu, Abu Road, and also BSCS Hospital being managed by the Global Hospital and Research Center in Mumbai. We have provided one huge building which can house about 1,000 patients. The government has started servicing there and the Brahmakumaris are providing food, shelter and other necessity help including ambulance, transportation and counseling, etc.
The newly built Brahmakumaris Mansarovar campus in Abu Road is serving as one of the best COVID care centers of India, having 500 beds specially reserved for corona patients provided to the state government of Rajasthan. A 100-bedded facility has been allocated in Brahmakumari's Anand Sarovar campus in Abu Road for the in-house staff of Brahmakumaris who are affected by corona disease.
We can see what is happening around us. It is very challenging, it's very distressing to see people suffering. But whatever best, as I would say part of this big unlimited family we can do, we are doing our bit. At Mount Abu we have created a 30-bedded ward, but most of the patients who come us, they are critical. So last night I decided to even open the intensive care unit to them. We have started a unit at Trauma Center also that has been supported by a gentleman who doesn't even know us, but he has come forward to support us.
J. Watermull Global Hospital Research Center in Mount Abu and its another unit, RM Mehrotra Global Hospital Trauma Center in Abu Road, are operating in their full capacity by providing 40-bedded and 30-bedded facilities for treating COVID-19 patients respectively. A staff of about 25 doctors and 50 nurses are working in day and night shifts treating corona patients in these hospitals. Counseling, well-being consultations are also being provided to COVID patients in the wards and elsewhere. About 200 corona patients line up daily and receive the CT scans of their lungs at the trauma center, which is the only CT scan facility in the entire Sirohi district. Hospital patient wards and COVID care campuses are sanitized after every 6 hours by the housekeeping staff of 55 persons. Over 900 corona patients have received treatment from GHRC hospitals in Mount Abu and Abu Road so far. The recovery rate of COVID-19 patients is more than 90% till now. Brahmakumaris are serving free of cost pure vegetarian, high-protein Sattvic meals to about 600 corona patients in Mansarovar and Anand Sarovar campuses every day. GHRC Hospital in Mount Abu and Trauma Center in Abu Road are serving the same meals to about 70 corona patients admitted in these hospitals. These meals are prepared by 200 serviceable kitchen staff of the Brahmakumaris and the hospitals within their premises with complete hygiene and cleanliness. Patients also receive coconut water, fruit juices and fruits along with their daily meals. Despite having meager food supplies in the tribal areas of Mount Abu and Abu Road, GHRC and the Brahmakumaris are taking full care of the corona patients by providing them nutritious food.
I really realized that last 14 to 16 months already that the food role, the diet role and its sattvic role, vegetarian food, how it helps into just to come out from the situation, like I would say actually it's corona to crown.
I am very much happy to see all my doctors team, volunteers team, health workers team and all devotees and Safai Karmis. They are doing the best of their work and making a full efforts to complete their knowledge and giving their best knowledge, best efforts, best trying to spare the for the patient.
सारी व्यवस्थाएं काफ़ी अच्छी हैं, दवा की भी और खान पान की भी और देखभाल की भी। सारी व्यवस्थाओं से हम पूर्णतः संतुष्ट हैं और ग्लोबल अस्पताल के लिए शुभकामनाएं हैं। यहाँ जो भी आए सब पूर्ण स्वस्थ होकर जाए।
यहाँ का सारी सुविधा बहुत बढ़िया है, अच्छा है।
आपको कुछ कमी
नहीं, बहुत बढ़िया। यहाँ फैसिलिटी भी नहीं, मैं तो यहाँ 2004 से आ रहा हूँ।
The hospital is deploying 3 mobile clinics on wheels, covering 3 to 5 villages every day and educating villagers about COVID and other infections along with treating minor ailments. A post-COVID recovery clinic, manned by a team of specialists, help patients deal with the aftermath of COVID-19 and restore them to health. As the disease outbreak is gaining height, procurement of medicines, injections, oxygen cylinders and essential food items are becoming difficult day by day. Brahmakumaris organization and the hospitals are trying to avail them at extra cost from different big cities. Along with all this, GHRC hospitals also face the shortage of doctors, nurses, paramedical staff, ambulances and oxygen support systems as more and more rooms are now converted into ICUs. Although the COVID situation is becoming critical in the country, still the Brahmakumaris organization and global hospitals are moving ahead with high hopes of winning over the deadly coronavirus.
We do know that there are always limitations, but as human beings, as part of the unlimited family, we should not hesitate to support someone when we can do it. Medicines are in short supply, oxygen is in short supply, the infrastructure is in fast supply. No one had ever imagined that this problem would be of this magnitude. So I'm sure with collective support and good wishes and I would say positive vibration, we would overcome this difficulty also. We are very hopeful that we would be able to defeat this situation also.